Substance abuse and its associated consequences continue to remain a major public health issue for the city of Baltimore. According to the Maryland Department of Health and Mental Hygiene, the number of drug and alcohol-related intoxication deaths increased in 2016 for the 6th year in a row, reaching an all-time high of 2,089 deaths. Moreover, 89% of all intoxication deaths in Maryland were opioid-related, and with 694 deaths in 2016, Baltimore City single-handedly accounted for a third of all intoxication deaths in Maryland. As such, the economic burden to society of substance abuse is significant in Baltimore. It's estimated that $11.6 million are spent per year on specialty substance abuse treatment programs, while an estimated $197.3 million per year are spent on hospital treatment of drug-related problems. As such, substance abuse is a deeply pervasive issue in Baltimore that is not only detrimental to the physical health of the community, but also hinders access to fundamental health resources such as housing, income, and education.
Moreover, history of incarceration strongly increases the likelihood of severe health limitations. It has been found that any contact with prison is more significant than the amount of contact with prison when looking at their influence on health limitations. It is known that drug users report experiencing fairly high levels of enacted and perceived social, structural, and self-related stigma. A recent study found that the current treatment system may actually stigmatize people who are in recovery, and that people with more prior episodes of treatment reported a greater frequency of stigma-related rejection, even after adjusting for other variables. Substance use-related self-stigma can be reduced through therapeutic interventions that are group-based acceptance and commitment therapy. Social stigma can be addressed through motivational interviewing and communicating positive stories of people with substance use disorders. Contact-based training and educational programs targeting medical students and other healthcare professionals can be used to address stigma at the structural level.
One of the biggest issues in the United States is that there is not proper treatment for drug addiction. As a result, we typically use the prison system to treat addiction. Incarceration has proved ineffective in preventing addicts from further abuse of alcohol and drugs. According to estimates, approximately 95% of incarcerated addicts will return to substance abuse after their release from prison, and 60 to 80% of them will commit new crimes. It also focuses more on addressing punishment for the crime and not the underlying problem that many of these addicted convicts have, which typically leads to them resorting to criminal behavior in the future. It can also make the problem worse as many drugs get smuggled into prison these days, so some who came in non-addicted could leave addicted. As a result, approximately 65% of prison inmates in the US meet the diagnostic criteria for addiction. Only 11% of people receive any treatment. The idea that prison can treat addiction via cutting inmates off is wrong on two parts. The reality is many drugs get smuggled in, and cutting them off cold turkey can lead to withdrawal, which has further dangerous implications. Of each tax dollar spent by the government on substance abuse, only 1.9 cents are used for addiction prevention and treatment, while 95.6 cents are allocated to the punitive system. This leads to a constant cycle of abuse, crime, and incarceration. As a result, our goal should be to give addicted offenders the option to complete a rehabilitation program in lieu of a prison sentence.
8 in 10 people who enter Baltimore jail suffer from substance use disorder. With their repeated arrests and hospitalization, their disorder and mental health are bound to deteriorate. Instead of arrests, these people need to be connected to appropriate services. That said, I propose the expansion of Law Enforcement Assisted Diversion Program, shortly known as LEAD, for Baltimore City Police Department. Instead of arresting those suspected of nonviolent crimes, such as low-level drug possession, the LEAD program would provide an opportunity for officers to divert them to case management and other supportive services. There has been a precedent in Seattle, Washington, that showed effectiveness of LEAD program in decreasing the arrest rates and costs of the criminal justice system. The program was launched as a pilot program in 2011 to 2015 and had voluntary participants with previous records of nonviolent crimes, such as drug possession. At the end of the pilot program, the LEAD group had 58% lower odds of at least one arrest compared to the control group, and the criminal justice cost and utilization was found to have decreased by $2,100 for the LEAD group compared to the $5,961 increase for the control group. Therefore, Baltimore City should standardize and expand the LEAD program in the city to reduce the number of nonviolent crime arrests and increase the number of those with SUD who are linked to treatment.
Over the recent years, Baltimore has faced an overwhelming surge in homelessness. It is not surprising that the drug use rates across the city have also reportedly increased. As individuals develop expensive addictions to opioids and prescription medications, they struggle to support such habits, as the majority of drug users come from lower socioeconomic backgrounds. As a result, these individuals are forced to sell their homes as a way to support their addiction. For those who fall victim to the prison system, a record of drug use makes finding housing after incarceration nearly impossible, as most landlords discriminate discriminate against these individuals. Without housing, they turn to drugs as a coping mechanism, creating a vicious cycle in which drug addiction can lead to homelessness, and a history of drug addiction can prevent someone from finding housing. Our solution is to develop a government-subsidized housing program for these individuals with temporary transitional employment. This will allow them to address and cure their drug addiction in a safe and supporting environment surrounded by similar individuals and counseling networks. By providing them with transitional jobs and housing, we can ensure their financial stability and guarantee a positive environment geared towards curing their illness and setting them on the right path for self-sufficiency and success.
Education is one of the best ways to treat the issue of substance abuse. Providing drug-related education to people of all ages could make a huge difference in this issue. Baltimore City and the state of Maryland already have some systems for drug education, but in many cases they likely provide insufficient or ineffective education. Thus, we propose an increased in required education about substances and substance abuse for both children and adults. For children, this can be implemented by expanding the current drug education programs in schools, and for adults, annual drug education programs can be implemented by employers. One way we can ensure the effectiveness of these programs is by including lots of research-based information, like information on the science of addiction and the kinds of negative effects substance abuse can have on your body. Presentations by people who have been personally affected by substance abuse are also effective methods of education. These programs will also make sure that the information is accessible, understandable, and engaging. They will not be long lectures or presentations with lots of statistics and scary stories. Rather, these programs will focus on starting a conversation about how each person in Baltimore can help reduce the problem with substance abuse.